Action.
Hello, this is Kenneth Vayon. I'm with SLCC's T.H. Harris campus, PN class 135. Today we're going to demonstrate for you the proper medication administration of parenteral drugs. And to do that, we have a setup here because we're not using a live patient or person. We've simplified the process. So to save some time, I'm just going to walk you through some steps, preliminary steps, and then when it comes to the actual injection, we're going to use this demo dose injector pad learning aid. All right, now what we have here, we have our medication order, or MAR, whichever one you may have. We have our Davis's drug guide for nurses, 16th edition from F.A. Davis. We have various sized syringes we're going to go through and needles. We have our demo dose vials, medications, PPE. We have our bandages and supplies. So, with that being said, let's begin. So the first thing we did was we obtained our medication order, our MAR, whichever one we would need at the time. And we see this is for a patient, Mr. John Doe. And we see he's been prescribed 4 medications. He's been prescribed iron dextran, dexamethasone, and Novolog NPH insulin. And while he's here, he's also been ordered a PPD skin test. So what I'm going to do, and I've already taken this drug guide and I've referenced it for all of the medications to see any special instructions, to see any contraindications that may be according to his system. I've also taken the liberty to look up any information that I might need to give him, such as what will the medication do, what side effects may he have, how long will it take to kick in, how long will the effects last, so on and so forth. Okay, so what I'm going to do, having done that, I'm going to prepare to draw up the medication. Now this is very important. I'm going to look at the order. I'm going to find the corresponding vial or ampule that the medication comes in. At this point, I'm going to compare it no less than twice. At this point, I'm going to do that by this. I'm going to look at the medication, look at the vial, look at the order, look at the vial. I'm going to match the name, make sure it's exactly the same name, make sure it's particular medications have some variations. Sometimes it may be, for example, penicillin sodium versus penicillin potassium. So, in a case like that, I would verify I have the exact same drug. I'm going to make sure that it has the right strength available that I need for the order. I'm going to do that twice with every medication, with all of them. All right. After I've done that, I'm going to prepare to draw the medication up into the syringes. At this point, I'm going to verify the order of the drug the 3rd time. All right. And when I'm drawing up the medication, my focus on verification is not only the right drug, but the right dose, once again. So we're going to start with drawing up our iron dextran. I'm going to start with that because for purposes of this demonstration, our iron dextran is going to be in the form of a glass ampule. All right. And there's some different things that you have to do when it comes to an ampule versus a vial. And the first thing I'm going to do here is I'm going to make sure all of the medication is going to drop from the top of this tip because I'm going to break the tip off. And I need all of the medication to stay at the bottom. All right, I'm going to prepare my needle. This iron dextran is going to be administered as an intramuscular Z-track medication. Okay, and so remember, all medications, all injections are given with sterile technique. All right, and so that being said, I'm going to maintain the sterility of the supplies like so. So we're going to take out our 3 cc syringe or 3 milliliter syringe. I cannot touch the inside of the plunger. I can only touch the outside. If I touch the inside, then it becomes unsterile. And I kind of need to break it loose a little bit. Just the tip. Work it loose. Alright, we still have sterility. And because this is a glass ampule, when we break the glass off, some of it is going to fall, may or may not fall into the liquid. I don't know, I can't verify that. So to be safe, when you break an ampule, you always want to use a filter needle to draw the medication out. I do not have a filter needle, but since this is a demonstration, we're going to pretend this regular needle is a filter needle. All right? And the way we aseptically do this, we're going to peel the package back just like this. We're not going to touch anything else, and we're going to lock our syringe on there. All right. It's not contaminated. Now, when I go to get the medication out of the ampule, I've already tapped it, all of the liquids at the bottom. I'm going to take an alcohol swab. Now you see, if you're not paying attention, you'll get the liquid back at the top. You have to flick it back again. Always correct your own mistakes. And we're going to take our alcohol swab, or a piece of gauze, because we don't want to cut our fingers on the glass. This is real glass. Alright, we're going to wrap the swab around the tip of the ampule. Alright. And if you look on the ampule, there's a line right around the neck. Okay. We want to break it above that neck line, because what we're going to do is because ensuring that neckline is in place, we can actually invert it upside down, and none of the liquid will come out. Now, this drug is going to require 0.5 cc's or milliliters. So I'm going to insert the needle into the liquid and aspirate. You do not put air into the ampule. And the reason for that is, if you inject air into it, it will all come out and break the airtight seal. All right, we have 0.5 milliliters in this needle. We have all the air out. I'm going to dispose of this needle because I can't use it because it's a filter needle. I'm going to take that off. I'm going to replace it with another needle, one that I'll use on the patient. And because this is a deep intramuscular injection, I'm using a 21 gauge needle. Pretty thick needle. Okay, that is ready to be administered. I'm going to lay that down. We're going to dispose of the ampule in a sharps container because it's sharp. All right. And when you have several shots like this, you may want to label each one. That's a very good practice to label each one so we don't mix our medications up. But this is going to be our iron dextran. Okay. The next injection that our provider has prescribed is dexamethasone. Dexamethasone is a steroid. And so what we're going to do is prepare our needle. We're going to use a 3 cc a 3 milliliter syringe. And the same thing applies. We're not going to break any type of sterility. And the correct order for this syringe, or for this drug, is actually 1.5 cc's. Use the same method. This is actually a 1-inch needle. And the reason it's a 1-inch needle, because I'm going into the deltoid muscle. And I don't want to go too deep with the needle, it's too long. Alright, this is a multi-use vial, and you can see the cap is still on it, so I don't need to sterilize it, because it's never been used before. So I'm simply going to take the cap, flip it off. That way I don't. Now if I touch that stopper in flipping it off, I have to sterilize it. But we don't have to sterilize it. So I'm going to take the cap off of my needle. I'm going to aspirate 1.5 cc's of air into this syringe. I'm going to insert it into the vial, and I'm going to inject the air into the vial. Okay. I'm going to invert it and let the air push out the medication that I need. And it didn't quite go all the way, so I'm going to help it out a little bit. I'm going to aspirate 1.5. I see there's a little air pocket in there. So knock the air pocket out. It's not a complete dose. Once again, without touching the stopper.
Can't see.
Without touching the stopper, I'm going to aspirate a full 1.5. Alright? An option would be to recap this needle with the scoop method, but we really want to avoid that option if we can, to avoid the possibility of needle stick. So in this case, we're going to activate the safety device, move the needle, and put a fresh needle on. That will be used for the patient. Okay? I'm going to lock it on. That's our dextromethasone. Now this patient is diabetic and also needs his insulin shot. He's been ordered 25 units of Novolog NPH insulin. So the same thing applies. Only difference with this, with an insulin and tuberculin syringe, is we're not going to be able to switch needles in this particular case. So we have to be careful when we recap this needle to not to bend it. Brand new vial. Now again, we verified that this is NPH insulin. It's not regular insulin. He was ordered NPH. So brand new vial. We're gonna flip our cap off. He's been ordered 25 units. See, I'm constantly checking. We do not aspirate any air or inject any air into insulin because it froths up, and NPH is thick anyway. So I'm going to do 25 units. Exactly 25. I'm going to scoop the needle up so that I don't touch it. There we go. That's his insulin. And finally, this physician has ordered a PPD skin test, which is going to test for tuberculosis, or the presence of the tuberculosis exposure or whatnot. And so this one's pretty straightforward. It's going to be given intradermally, which is on the surface of the skin, in the dermis. Again, I'm not going to aspirate any air into the needle. I'm not going to inject any into the vial. What I'm going to do is verify, once again, put the cap up. And I'm going to pull out, he's been ordered 0.1 cc's. That's what we're going to do. 0.1. Not much. 0. Use what we call the scoop method. You kind of scoop up the cap, put it on like that. That is going to be his intradermal shot. Now, this needle looks way bigger than what it is. Okay, we would not use a large size needle for an intradermal shot because we're barely going in. But it's not as big as it looks, so keep that in mind. All right, so we have our medication ready. We're going to take our vials. We're going to go into the room, and for this portion, we are going to use our gloves as part of standard precaution. The reason we didn't use gloves before was because we did not really have the danger of exposure to body fluids, except our own if we would stick ourselves, but there would be no cross-contamination. We would just have to get rid of the rest of the material and start over. But we're going to actually inject the patient now. So we're going to come in here, and the first thing we're going to do, introduce ourselves. Hi, my name is Kenneth. I'm your nurse today. And the doctor has some medication, some shots for you. Would you mind if I give you your medication? We're going to get consent from it. All right? We're going to have our order in our face again, because even at this point, there's a chance we could have made a mistake. What is your name, sir? What is your date of birth? Use at least 2 identifiers. We verified he's the right person. Okay. The most important shot for him to get right now is probably his insulin. So we're going to do his insulin shot. Now, insulin is subcutaneous, all right? And what we're going to do is we're going to give him a shot in the back portion of his arm right here. And so let this demo pad represent that. And we're going to swab that area of his arm. We always go inside to outside. Okay? And we're going to let it air dry. We don't blow on it. We don't do any of this because that's going to contaminate. All right? I'm going to say, okay, Mr. Doe, I'm going to give you your insulin. It's time for your insulin. You're going to get 25 units of insulin. Okay? Subcutaneous shots are normally given because you have to stay within the subcutaneous tissue and not go into a muscle. Normally we will give it at a 15-degree angle, but this is an insulin needle, U100. It's got a much shorter needle, and he's got a pretty good bit of fat on him, so we're able to give this at a 90-degree angle. Now I don't know, Bernadette, if you can, am I getting good shot? You can view it? Okay. I only get one shot at this. So we're going to give him his insulin. We're going to make sure the bevel of the needle is facing upward. We're going to bunch up. Can you see that?
No.
My hand. Can you see my hand?
Yes.
Okay. We're going to bunch up the fat like so.
There you go.
We're going to go in with our non-dominant hand. We're going to take our dominant hand, go in, bevel up, and inject our insulin. There we go.
Okay.
This is a safety needle. We're going to activate the safety device. All right. That's done.
Wow.
Okay.
Okay. That's pretty cool.
Now, he's been ordered iron dextran for because he's experiencing a lot of blood loss right now. So, in my nursing judgment, I'm going to say this is probably a more crucial drug right now. So, he's been ordered 25 milligrams, and we've determined that it is 0.5 cc's. Now, iron tends to stain, so what we're going to have to do, we're going to have to administer this in what we call a Z-track method. And it's going to be kind of difficult to show this on camera, so I'm going to do my best. But the Z-track method, and in this case, I'm going to give you, it's an intramuscular shot. So this is going to a muscle. And I'm going to use the example of the ventral gluteal site, okay? Right here in the hip, okay? Tends to be less fat right here than back here. This is the dorsal gluteal. So I have a better chance getting into the muscle right here. Now this drug really is miscolored and it tends to stain, so we're going to give it what's called a Z-track. And so when I do it on this pad, assume that it's this part of the anatomy, all right? I'm going to take my non-dominant hand, I'm going to take this part of the hand, and I'm going to take it and move the skin over like this. Okay, can you see that?
Okay, now I can.
So if this is the side of the hip, I'm going to take my hand and move the skin over like this.
Okay.
Then I'm going to take my dominant hand and insert the needle into the muscle. I'm going to inject the medication slowly, no less than about 5 seconds per cc.
Mm-hmm.
When I'm done, I'm going to slowly pull the needle out, and as the needle comes out, I'm going to let go of the skin. It's going to come back in place, all right?
Okay.
So that's what I'm showing. I don't have a third hand to hold it up, so that's what we're going to demonstrate now. So I'm going to take the cap off the needle, and of course, if the patient is in bed, we're going to turn him on his side. Okay? And I've already explained all this process to the patient. I'm going to take my non-dominant hand and see if you can get on top. I know there's some shadows here.
Mm-hmm.
I'm going to move it, and it's kind of slick. We have to dry him off
Mm-hmm.
because it's not going to work. All right. Kind of wet glove there. I'm going to move him over like this.
Mm-hmm.
IM shots go at 90 degrees, and they dart in. 1, 2, 3. It's 1/2 cc. I go 3.5 seconds. All right. I'm going to pull the needle out slowly, and as it comes out, I'm going to let go. And it's going to come back. All right.
Wow.
Can you see the needle? We're going to activate our safety device. Okay. Finally, okay, the physician has ordered our dexamethasone shot. Now, I said earlier you want to try to label your needles so you don't get them mixed up, but if you don't have any labels, I differentiated this needle from the other one by keeping the cover on, so I didn't get it mixed up. So I didn't Z-track this one and so on and so forth. Okay. Now, dexamethasone is a corticosteroid. Now, as I'm giving all of these injections, I'm asking the patient if he has any drug allergies. I'm asking if he has any questions about the medication, and I already have all the answers. If I don't have the answer, I will find out the answer before I give him the medication. This is a corticosteroid that's going to last about, the drug guide says 2.75 days, so we'll say about 2 or 3 days for the patient. It's going to make him feel better, probably suppress any type of immune response that he's having. Make him feel better. So we're going to administer this drug to the deltoid. All right. The deltoid is this muscle right here at the top of the bicep.
Mm-hmm.
It actually covers, it looks like a Greek delta, and it covers this part of the arm. Men normally, in most cases, have a larger deltoid, so we can go a little bit more than women and children with injections. So To find the deltoid, I'm going to feel for the acromion process right here, which is part of this pelvic girdle. I'm going to find the acromion process. I'm going to go a couple of fingers down. So if the acromion process is here, I'm going to put 2 fingers. And right here is where I'm going to inject. All right? So that's my landmark. I don't want to go too low because the bicep splits. So I want to go about right here. So let's say this is his deltoid. All right? I'm going to take my pad. I'm going to swipe it, my alcohol. And again, IM injections go at a 90-degree angle. That's why we use a longer needle to get into the muscle. And I'm going to find his deltoid. And when it comes to the deltoid, you're going to go, we go to IM injections, we go opposite then, subcutaneous. Subcutaneous, we pinch. But in IM, we want to hold it like this because we don't want any fat. So we're going to hold the skin tight, 90-degree angle, bevel up. We find our bevel, it's up. 1, 2, 3. That's it. Activate our safety device. All right. So we've been giving him a shot. Now, what you're going to want to do when you inject it, pull the plunger back before you inject it to make sure there's no blood. If this had been a live person, we would have done that. If you get blood, then you're in a vein. And we don't want to put this drug into the vein. We want to put it into the, what happened?
Made you too white.
We don't want to put this into the vein, we want to put it into the muscle. Okay. So, our last injection is our PPD skin test, which is going to be an ID injection. Now, we're going to go, let me show you this on the camera. We're going to go somewhere around here. Now, if I were giving this, if the patient's arm looked like this, I'd be very careful because I see some scars here. All right. I don't want to put it anywhere that a scar may be mistaken for the result, because we're going to have to put the tuberculin, the PPD in there, leave it for 48 hours minimum, and see if it has some type of reaction, much like an allergy test. So, once I find that area, and this sometimes can be the most tricky one. Now, I only have 1 tuberculin syringe, so I couldn't practice this. So this is going to be the real deal. I was not able to practice this one, so hopefully it works. But I'm going to cleanse the area, let it dry. All right. I'm going to go bevel up, and I'm going to go no more than 5 degrees. Get the liquid off. 5 degrees. If you picture like a protractor, this is 0 degrees. 1, 2, 3, 4, about 5. That's the angle I'm going to go in. I mean, very close to the skin. I'm not going to go deep. I'm just going to go barely in there. I mean, barely. Lift up. And it's going to make a wheel. You see?
Mm-hmm.
And there it is, the wheel. The skin has bubbled up. Okay, I'm going to activate the safety device and be done. I'm going to give the patient the proper instruction on this. There should be no blood coming out of it, or very little blood. And we're going to instruct the patient that we're going to come and look at it in 48 hours. And that's it. We're going to clean up our supplies, make sure the patient has everything he needs before we leave, and chart and document that we've done this, and follow up accordingly. Thank you. Have a good day.